Welcome to today's presentation, part one of our cannabis webinar series, Considerations for Cannabis Legalization in Your State. We would like to note that today's presentation is provided free of charge and is available in the public domain. Also, the information presented today are the views and opinions of Ali Maffey, our presenter, and do not reflect the official position of HHS or SAMHSA. Please let us know if you have any questions about the information in this disclaimer. It is my pleasure to introduce our presenter today. Ali is the Policy and Communications Unit Supervisor for the Violence and Injury Prevention Mental Health Promotion Branch within the Prevention Services Division of the Colorado Department of Public Health and Environment. Her unit includes the Healthy Kids Colorado survey and multiple substance misuse prevention programs that fund community-driven prevention and social norms change efforts from a shared risk and protective factor approach. Ali helped launch the first state public health response to adult use marijuana legalization in 2014. Ali has been with the CDPHE since 2012. After working previously with national nonprofits on policy change and professional development efforts, and working in suicide prevention and emergency preparedness at El Paso County Public Health in Colorado Springs. We're so excited to have Ali with us, and now I'll turn the time over to her.
Thank you all so much. I am really excited to be with you here today and share a little bit about Colorado's experience over the last 8 years or so. It's actually been closer to 8 since the program launched. So I'll share a little bit about our program and what we've learned along the way. My apologies, since I'm going to be sharing some videos. I optimized my streaming for video capacity, and that means I can't see any of your faces. So I'm speaking to a blank screen here, and so apologies, it feels a little awkward, but I'm really excited to share what we've learned. So in 2014, the Colorado State Legislature passed Senate Bill 14215, which tasked the Public Health Department with educating Colorado residents and visitors about safe, legal, and responsible use of retail marijuana. And we learned a lot right off the bat about swim lanes, for which state agency does what related to marijuana legalization. And so as we go through today's session, I'll share probably all of our top lessons learned over the last 10 years, but I'm happy to visit back on any of them in particular, and share a little bit more as we go along. So the first one actually is before we even get into this, and that is language, retail marijuana. In our statute, we differentiate medical from adult use using the term retail. I don't think there's any one right way or best word for how we differentiate or how we talk about recreational use cannabis. But we've really struggled in our state with language and shared language and what's in statute, what is legally defined. So it's just been a bit more of a challenge. We tried to steer away from recreational marijuana because we didn't want to norm that it was a recreational drug within the community. We definitely speak specifically to marijuana legally because cannabis is an inclusive term that also includes hemp, and industrial hemp has a different regulatory system in the state. So very often when we're talking about the laws and policies within our state, we will use the term marijuana. But I do want to say that we are very aware of the challenges and racist past of the use of marijuana. So I think language is something that continues to evolve in legalization and medicalization efforts across the country that I don't think we've figured out how to talk about this well and universally. I think oftentimes we resort to what is legally defined in our statute within Colorado. So lesson one really was figuring out some of the swim lanes to address marijuana. Which state agency is managing medical? Which parts about medical marijuana? Who is regulating? Who's doing the laboratory testing and quality assurance? Who's doing food safety? Who's doing prevention? Who's educating? Who's using data? Which data are they using? who is focused on impaired driving safety and enforcement of all these new laws. And I mean, this isn't just a first draft of thinking of some of the things that may happen after legalization in your state. And what we found to be true is that as other states have since legalized, we often get calls from every single one of your state agencies separately of trying to learn more about what does this mean, who's doing that, which agency is managing this. And so it's really hard to figure out and get on the same page. We were really lucky within the state that our governor's office, represented by this seal at the bottom, at the time hired a full-time staff to help coordinate across state agencies and actually figure out some of those swim lanes. You know what, you take the lead over here, you take the lead over here. If we're going to have meetings and talk about that, let's make sure all of these state agencies are in the room. So there's really no one right way to do it, but it's just something to think about of all of the different state agencies that will be involved in legalization efforts. How can you be coming to the table often enough and frequently enough to make sure that you're having candid conversations about who's taking the lead on which role? So just within our state public health department, some of the roles that we identified, we're managing the medical marijuana registry. We have a department in charge of data and trends, our epidemiologists who are looking at retail marijuana health effects, patterns of use, and health impacts over time. We have the retail marijuana education program, which I manage. Then the other responsibilities within public health include laboratory testing and assurance, food safety, waste disposal, and medical and retail marijuana research grants. And then all of this work really requires money to do the work. And so lesson number 2 for us was, how do you pay for the work before the money comes in? Very often your state agencies will, and your legislature will say, well, we have money coming through the tax dollars associated with legalization that we'll be able to pay for some of this work. But the challenge really is that revenue isn't available till after stores open and after the revenue is collected and then given back to your general fund or whatever type of fund that you have, and then dispersed out to the state agency. So some of the work that's required in all of those swim lanes requires money, but the money isn't available just yet. So that timing is really quite a significant challenge. All of this is not necessarily something that you need to know the details of. This is just how the tax revenue is handled within the state of Colorado. We have excise taxes, sales taxes on retail marijuana, sales tax on medical marijuana, and then a special sales tax. Part of it goes to the general fund, part of the excise tax goes to a school capital construction fund. The rest comes in to be shared into the marijuana tax cash fund and divided across state agencies for the purposes of regulatory oversight, youth prevention, substance abuse treatment, and public safety. So the details aren't that important. Every state handles their tax revenue slightly differently. This is just how it's handled within the state of Colorado. So lesson number 3 was really thinking about how do you improve data trend and reporting. It really requires looking at data in new ways, particularly back in 2014. It was a lot to change across the behavioral risk factor surveillance system and YRBS given legalization. A lot of those efforts have been underway. The Council of State and Territorial Epidemiologists has done quite a lot of data improvement. This is emergency department visits and hospitalizations, but I will say like our poison control centers have also adjusted to change over time. And then really thinking about how you bucket the timeline of data to really think about what was available. How do we look at the data differently given legalization? So we had pre-legalized access to legalized medical marijuana. Then we have since it was legalized, but then there was a time frame of about 10 years before there was any commercialization of medical marijuana, and then commercialization for 4 years until retail marijuana opened up within the state. All of this information, and I was going to put this in the chat for you, our data and trend reporting and how we share that across the state and with other states is all available at this marijuanahealthinfo.colorado.gov website. And looking across that website, you can, if you click on health data, you can click by data source. We have BRFSS, Child Health Survey data, Healthy Kids Colorado Survey, which is our YRBS Plus. It's a much larger survey then YRBS within our state. Then we have PRAMS, which is the Pregnancy Risk Assessment Monitoring System, and our hospitalization data and our poison center data. So lesson number 3, and I'm really just speaking mostly to the public health side of data here. There's also quite a bit of law enforcement data and motor vehicle crash reporting data, things like that to consider along the way as well. But those are not my areas of expertise, so I didn't include those examples in all of our data lessons learned. Lesson number 4 is, what will you say about the health effects of marijuana? So this is available at the same link that I just added into the chat. And if you go over, you'll see a drop down called literature review, and you'll see evidence statements, public health statements, and public health recommendations. This is a systematic literature review process from the Retail Marijuana Public Health Advisory Committee, which was tasked in statute with actually summarizing all available literature on the health concerns related to marijuana to make sure that we were speaking accurately and to the known science of what health-related concerns or benefits should be considered in marijuana legalization. And we, at the time in 2014, this was incredibly vital because there was so little trust for the federal government for any of the research that was coming from the feds on what health effects or what health concerns were related to marijuana. And so we, at the time, couldn't say, well, the CDC says or SAMHSA says, because those were not trusted resources in the initial legalization. Since that time, things have changed quite a bit. The National Academy of Sciences has come out with a report that's a bit more moderated and not some of the early NIDA messaging that was definitely fear-based about marijuana legalization, a bit more moderated in how they talk about health concerns related to the drug. But it is something to really be aware of and make sure all of your state agencies are on the same page. All of your prevention specialists across the state are on the same page of what will we say are the health concerns related to marijuana and how well do we know that that is true. So when you look at that website, if you look at the evidence statements, you'll see the things that have I'm looking it up right now to make sure I'm using the right terms, but we have moderate amount of evidence, limited body of evidence, mixed evidence, insufficient evidence, or substantial evidence. So for instance, we found substantial evidence that daily or near daily marijuana smoking is associated with pre-malignant lesions in the airway, because we know smoking anything is bad for your airway. So it's important to make sure that you are on the same page on those messages. Lesson number 5 is creating a responsive regulatory framework, really thinking about how we can apply our lessons learned from alcohol and tobacco related to policies that limit availability and accessibility on place, promotion, product, and price, and the appropriate amount of enforcement like SINAR checks, but the equivalent for marijuana industry or cannabis industry, to make sure that they, whatever requirements are put in place to limit access based on place, promotion, product, or advertising, things like that, that those are being followed. So just a few examples of the regulations in place in Colorado early on. When it came to place, we did include cannabis originally in our smoke-free spaces, housing, parks, and cars. That had a lot of other challenges because then we had a lot of tourism related to cannabis and no real legal place for people to use. So things have changed slightly over the years of trying to find that right balance. Tobacco-free schools policies, cannabis was added to tobacco-free schools, except in cases of medical use. We've looked at retailer education, restricting access at home, which really comes down to a lot of education around safe storage, local restrictions on density and buffer limits, hours of operation, number of stores that are allowed in different areas, and then promotion, really limiting signage and advertising on the outside of buildings, as well as advertising into traditional venues. So advertising explicitly cannot appeal to youth. Originally, no billboards were allowed and no mass media was allowed unless less than 30% of the audience of that mass media was under the age of 21. And then aligning medical and retail advertising restrictions for cannabis products became really important at the time as well. And then talking a little bit about product and packaging. There were standard warnings on all of the products that the product packaging can't appeal to youth. No cartoons were allowed to be used in the packaging, and they had to be child resistant, opaque, and resealable in order to promote safe storage for young children to continue to prevent them from accessing the product over time. In February 2015, due to some of the monitoring of the data and some of the health concerns, they did reduce the potency or concentration of edible products and had to score them into individual serving sizes. And so each serving has to be 10 milligrams of THC and up to 100 milligrams tops for any edible in order to prevent overuse of edibles and severe reactions. Also part of the product was the labeling, requiring of this symbol, which designated that the product did include THC as a warning. Some states have looked at pot symbols, the leaf. Other states have all approached this in different ways. I don't think that there's one universal symbol that works across the entire country to really warn about marijuana use in a way that would actually deter young children from accessing the product. We know like the Mr. Yuck stickers actually became appealing to youth and did not work to reduce poisonings among young children early on from early injury prevention research. And so really thinking through who is the symbol for to warn that the product contains THC, because making it understandable to a child is actually pretty challenging. Other new limitations that were put on later after initial legalization were that they couldn't use pre-manufactured products. They couldn't apply a THC coating to the outside of like existing gummy bears. Gummy bears that look like gummy bears, could no longer just have a THC application on top of those products. No appealing shapes, so they couldn't be in the shape of animals, humans, or fruits. Interestingly enough, they didn't add vegetables to the list, so you probably still could have marijuana edibles in the shape of broccoli. And they weren't allowed to use the word candy on any marijuana edible products. So those are just some examples of some of trying to learn the right lessons from tobacco, from alcohol, and apply those to cannabis products over time. And then lastly, we have price, and this was hinted at a little bit before, of the state excise tax, the state special sales tax, and then locals adding additional special sales tax. And really this came down to, we know that youth are price sensitive. And so when the price of a substance like alcohol, tobacco, or marijuana, or cannabis products in this case, when we know that they are high enough, they can deter youth use. But we don't want them to be so high that we drive a very thriving black and gray market. We know that there are black and gray markets already existing in nearly all of our states. And so we don't want to incentivize those markets to keep really low prices because the legalized products are so high in cost. So it really is finding the right balance in those prices. And so that was lesson number 5, about applying all the lessons from alcohol and tobacco. And in 6, it's really about getting that information out quickly, thinking about those CSAP strategies and information dissemination. How could we do that as quickly as possible in a way that honors the public will? So in our case, the voters approved cannabis legalization through an amendment to our state constitution by a overwhelming majority. And so our governor at the time really approached it with how do we honor and respect the will of the people while continuing to protect public health and public safety, was our motto in that approach. So what does it mean to get information out in a way that respects the voters, but also has medically accurate information? That goes back to lesson number 4, I believe, which is about what will we say about cannabis products. So here's our early launch timeline, which was not ideal. And this was a lesson learned from Colorado that please don't repeat in your states as much as you can be aware of this. But the vote occurred in November 2012 to legalize marijuana for adult use in our state constitution. It also legalized industrial hemp for other types of products. But the first stores didn't open until January 2014. So they had a little over a year to write all the rules and regulations for those first stores to be able to create, how they would manage the seed to sale products, and what the regulations would be around where the stores could be located and how they could operate and how they could advertise. But that means, like we talked about with the revenue coming in, it took about 6 months for all the tax revenue to first come in and then get disseminated to state agencies in July 2014, so 6 months after stores opened. And so we couldn't even start thinking about our public education efforts until after July, which then meant it took us another 6 months to plan for our campaign messages. So the very first public education campaign did not launch until January 2015. So with existing staff time and by creating a Google site, we tried to create a state website. It's now cannabis.colorado.gov is the current state website. But we created that early on to start answering questions as early as possible, right as the stores were opening in January 2014. But that was really a challenge for us because as you all know, you're often paid for by other funding sources and you have deliverables for those funding sources. So using state agency staff and time and resources to create a website that and educational efforts that none of us were being paid to do was a bit challenging early on. So our first campaigns launched in 2015. It took us a little bit of time to get onto TV and then to kind of audience by audience roll out more education efforts over time, just because, as you know, authentic audience research for social marketing campaigns it takes time to really test the messages with the audience and make sure that they resonate and are effective for the social norms that you are trying to shift. So we started with general public education, then inclusive of TV spots. Then it took us a few months to get out trusted adult messaging and then a Spanish language campaign. Whoops, I did not mean to. Are you gonna let me go back a page? There, okay. Spanish language campaign messaging, then launching tips for tourists, and then youth specific, and then pregnant and breastfeeding. So it really kind of took time to roll out each of those audiences as we went along. In 2018, what this timeline doesn't really show is that we did a total campaign refresh where we tried to move away from just knowledge and attitude shift and really focusing on behavior shift among cannabis users. And then in January 2020 and moving forward, we had to pool a lot of our messaging during the COVID. During COVID, our budget was cut by 80% moving forward. And so our efforts have been a bit more restricted in the last 2.5 years. But here's an early overview of all of our campaigns. And please let me know if you're having a hard time hearing it in the chat. But I'm going to hit play and hopefully you can hear this just fine.
On January 1st, 2014, Colorado became the first state in the nation to sell retail marijuana, making us the first state to develop public education campaigns about safe, legal, and responsible use. It was a first-of-its-kind challenge, so we developed a first-of-its-kind approach, one made up of 5 unique research-tested campaigns, working to break down taboos around a controversial topic and provide clear, concise information in relevant, attention-worthy ways. From a public education campaign that informs Colorado residents and tourists of the who, what, when, and where of Colorado's new retail marijuana landscape, to campaigns that satisfy the educational needs of specific audiences, such as pregnant and breastfeeding women and Colorado's Latino population, to a 2-pronged youth prevention effort featuring complementary campaigns that speak directly to our youth audience, as well as to the adults who they trust. We are successfully educating an entire state and encouraging the adoption of safe, legal, and responsible retail marijuana practices by using messages that are tested and known to be effective with each audience. And it's made a difference. We've achieved nearly 344 million impressions across all campaigns since we started. And adults familiar with the Good to Know campaign are more than twice as likely to know Colorado's retail marijuana laws than those not familiar. From city dwellers to rural audiences, from marijuana advocates to its critics, from adults to their children and from residents to tourists, the Colorado Department of Public Health and Environment has paved the way and set the standard for developing an inclusive, comprehensive approach to retail marijuana public education and youth prevention.
And so some of what we saw in these education efforts, we were really proud of, but our early education evaluation efforts showed that we had an 11% statistically significant increase in knowledge of the laws, and we had statistically significant increases in perception of risk across all areas except for pregnancy. And that really made sense. Because the pregnancy campaign did launch so much later than some of the other campaigns. You may have noticed that the Spanish language campaign looked very different from the cartoonish nature of our early ads. And this was very intentional based on the audience research that we did with the population, where there was a lot of some of our research actually found that our Spanish language news media was not talking about legalization within the state, that people had no idea it really was legal, and they were skeptical that what they were hearing was really rumors and not actual truth about legalization. And so a much more direct to camera, trusted messengers within the Spanish language media realm. So these very popular broadcasters at the time did a lot of straight to camera talking about it really is legal in the state now, and here's what that means for you as parents to have conversations with the youth in your lives. We had a state trooper whose native language was Spanish, straight to camera saying, yes, it is legal. Yes, you can use legally. It still doesn't mean you can drive legally, drive while under the influence and that be legal. And here's why. And so it was a very different approach in Spanish language. And that was very intentional based on the audience research that we saw. So with the Trusted Adult campaign, we really did try and tap into those resources. We know that that's a protective factor for youth, as you all know in your work for substance misuse prevention as well, that supportive teachers, youth who agreed teachers care and encourage them were youth who agreed that teachers cared were 1.7 times less likely to use marijuana. Same with family rules, about the same with youth who felt like the oopsies that they could talk to a parent. And if a parent felt like it was wrong to use, their children were 4 times less likely to use. So that was really important for us to highlight. The youth prevention two-sided approach that they talked about was the youth-centric campaign, which was called Protect What's Next. Can marijuana really get in your way of doing the things that you want to accomplish? So it was very authentic and relatable, positive focus, very youth-owned messaging, but then it was paired with the rational, trusted adult education. Yes, it's legal. You need to know how it can still impact the youth in your lives, and how to have conversations with them. So I'm going to show one of the parent ads here. And I wasn't even a parent yet when these first came out, and they made me cry then. So they definitely make me cry now.
Remember when you made a baby? Check that. Remember when you had a baby? Amazing, right? But what's more amazing is everything you've taught your baby to eat, to walk, to talk, and pretty much everything else they know. That makes you amazing. And you're still teaching them every day. Only now, it gets harder. Now it's stuff like birds and bees and booze and weed, which is awkward and messy. But when hasn't it been? Remember diapers? So don't let awkward get in your way. Talk to your kids about marijuana so you can help them keep it from getting in their way. Get tools and tips at goodtoknowcolorado.com.
And so it really paired well with our youth campaign about protecting what's next, of not letting marijuana get in your way, and the parent campaign. And we had a similar one for teachers, was very complementary in the same type of language that it used.
Remember when you made a baby?
In the wrong spot to advance.
Remember when you made a baby?
There we go. So we had a lot of talking tips and trusted adult materials to share with youth that were all age appropriate, and community partner resources and toolkits for them to be able to download and run the campaign. Then the Protect What's Next youth campaign, we did challenges at schools, that we planned adventures. We did a lot of different ways for youth to get engaged in apprenticeships that we were promoting, TEDx Mile High partnerships, just some really neat opportunities to really maintain that goal-oriented focus. And then here's one of the ads that we used for youth.
Hi. You look fantastic. You too.
Find what's next for you and go get it with the goal getter at protectwhatsnext.com.
So those were our early ads. We did see that we had higher rates of use among LGBTQ plus youth within the state. And so we made sure that our ads were inclusive of populations that we definitely wanted to reach of youth within the state. Just a word to the wise, this young gentleman was not wearing a seatbelt. So we had to have them like get in closer to his face while he was in the car because we didn't want to promote not wearing seatbelts in a car because the retail marijuana education program is co-located in our violence and injury prevention branch. And so couldn't exactly be putting out ads with a teenager not wearing a seatbelt in a car. So, you always have to be careful, make sure you have multiple subject matter experts on site when they're recording these things so you don't end up with challenges like that. Oh, please don't. There we go. So these were some of our early campaign ads. And what we saw with our evaluation of Protect What's Next and our Trusted Adult campaigns was a 12% statistically significant increase in plans to talk to their children about the risks of using marijuana. We saw an 11% increase in the perception of risk amongst youth. Perceptions of risk for teenager use increased among adults. And then we did see that youth who saw the campaign were more likely to agree with health risks from using marijuana regularly than those who had not seen our campaign. So then when we did the campaign refresh in 2018 and moved to more focusing just on cannabis users, as well as then parents and youth, and then pregnancy and breastfeeding as well. We really focused away from the general education resource for the whole state audience, adult audience, and just focused on retailers and cannabis users specifically. So our youth campaign was called Find Your Moment, a very similar in approach to the Protect What's Next. So really what's meaningful for you, how do you connect with it, and how can marijuana get in the way of that? With adults, we focused Your Words Have Power was the name of that campaign. And it was really kind of a cool campaign about how the stickiness of our words onto kids and how our words travel with them was very impactful. And we saw that youth exposed to the campaign were significantly more likely to agree that marijuana made it harder to think and do things, and that it did have an effect on one's body and could cause cravings. And then adults who live with children had statistically significant increases in plans to talk to children about the risks of marijuana, perceptions of risk for teens using regularly, and perceptions of risk of unsafe storage in the home. Our messaging to users who were parents were really focused on locking it up, keeping it in a safe, not using it in public so that you weren't modeling it in front of youth, and respecting our area. And you can see we had Meg the bud tender wearing the very well-known green badge. And this campaign was just like a little harder to break through, to be honest. It was a lot harder to reach users with cannabis consumers with these safety messages. And so we really had to focus on certain populations. There was one ad, and my apologies, I tried to find the image of it, but essentially there was a commercial where Meg the bud tender opens up a cabinet and her roughly like 8-year-old son is up in a cabinet, and said, youth can get into everything, or young kids can get into everything, and you never know where you might find them. So you have to be extra cautious about how you store your cannabis products. And that ad had, when we tested that with users, they were 3 times more likely to say that they would store their cannabis products safely after watching that ad. So it had a very significant impact. And what our evaluators found out is that we were one of the only states really focusing that much on safe storage. But since then, things have shifted. So the Meg the bud tender totally went away. All of our pregnancy and breastfeeding efforts went away during COVID after we received that 80% budget cut. And instead, what we did was combine our efforts with other public health agency and programs, because all of our youth campaign efforts looked the same. So kind of the Protect What's Next looked just like Find Your Moment, which looked exactly like some of our safe sex advertising, which looked exactly like some of our alcohol prevention efforts, which looked exactly like our tobacco prevention efforts and our vaping prevention efforts. And so we decided to pool all of our resources and launch parent education and youth education, social norms campaigns around healthy decision making that were not specific to any one substance or one health behavior, that they were a little bit more substance agnostic, health behavior agnostic, and really just about the role that trusted adults play in driving health decisions and the value of youth connecting to something that is more important to them than the health decision, like that unhealthy decisions could get in their way. And so how do they connect to their broader goals? So the Forward Together campaign has been an experimental effort in our state to be able to look at whether or not this substance agnostic approach is actually effective over time. How are parents and trusted adults providing support to young people, and how do they feel about those connections? And so what we learned is that young people want their parents to spend more time listening to them, and that they're not looking for parents to always solve their problems. They don't want to be a burden, but they often feel like talking through challenging things and hard things what resulted in being a burden, that by talking about their problems or struggles, that they were being a burden. The key takeaways from our research with parents is that raising a teenager is hard, and it's really helpful to know you're not alone. Mine are only 5. I also agree that raising any kids is hard, and it benefits to know you're not alone. That many parents check in, but they need help having meaningful two-way conversations that are age appropriate. And when their children come to them with problems, they do tend to try and solve rather than to listen and ask for what kind of help the youth are looking for. And that they focus sharing their experience with their children, but it feels very different to the experiences they had themselves. So trusted adults felt most confident when they could provide support. They struggled to juggle the demands of jobs and finding ways to connect with youth in a meaningful way, and they want to cultivate trust. So our campaigns really focused on being open to those moments of connection and making space for them, both for youth among their peers, for youth being willing to talk to trusted adults in their lives, and for the adults to talk to the youth as well. Again, we had, I'm going to skip over this one for now, it'll be there. It's just some of the challenges that we had because this campaign launched right after COVID struck, which was also an incredible opportunity to focus more on the quality of conversations that are happening in the home. But it also removed youth from one of their major supports of their connections with peers. But we did see that about 4 in 10 youth report campaign awareness, and that among parents 2 in 10 reported awareness. Whoops. So we did see some changes over time, but COVID definitely, this was already an experimental approach, and COVID definitely caused some additional challenges.
A lot of these kids don't know their purpose. They need to know that they have that coach in the corner to back them up. I got involved in the street life as a young kid, and I wanted to share my story to help keep other kids from making the same choices I did. The biggest thing that helps me is just my past. I think that's what makes it easier for me to connect. I met Abel when he was really young. He was friends with my son. He had already started to dabble with things that was going on in the streets. I remember being that kid. I didn't have nobody. So when I came back into contact with him, I said, "So you want to fight? Let's go boxing." Abel didn't win his first fight. I remember just coming up to him and encouraging him. Bro, all the work that you put in, it paid off. Now you just gotta keep working. I think Abel's just come a long way. The self-discipline, the pushing himself, the swinging when he can't swing no more. I just want to be there to be able to remind him that he can do it. He got this.
Okay, those ones always make me cry, and I'm not even going to play some of the other ones because they make me cry even more. But I will say that, there we go. Sorry about that. I put a link into the Forward Together campaign. If you scroll down about halfway, you can see other stories of connection from Lindy. Lindy's mom was white, and Lindy is I believe Lindy is the mom, who is white, and Lindy's daughter is biracial. And so starting conversations about race and how her daughter experienced the world differently than she did as a person of color, and really entering into those harder conversations. And then Christine is the parent of a transgender child. And so again, how to have harder conversations with youth. And these ads have been incredibly effective within the state, and we've had incredibly positive reaction from both youth who appreciate that that the adults are getting the same messages to be able to engage in these harder conversations and increase their willingness to be able to do that. So just a few more lessons learned before we go to question and answer time. So the final lessons learned, and this is kind of implied from that very long number 6 about getting education and prevention messages out with the public, is really making sure that you are listening to audiences, that you are hearing how they resonate with the issue, how they talk about the issue, and how you need to enter that conversation with them, whether it's about education amongst consumers or prevention with parents. It's vital to make sure that you're having a two-way conversation with the audience and really hearing what resonates. I think number 8 was really hard. Even 8 years later, we have some groups that are very anti-legalization and continue to move in those spaces to try and repeal some of the legalizations and then legalization efforts. And then we have really strong advocacy groups to expand and nationalize legalization. And I think just knowing that sitting in this space of education around public health, around prevention, and around safe, legal, responsible use is always going to upset both sides in some way. Using that safe, legal, and responsible use as our mantra and as our motto with our stakeholder groups, which include both groups that are trying to reverse legalization as well as the cannabis industry, is always coming back to that. Like, are we promoting safe use? Are we talking about what legal use means? Are we educating about responsible use? And that is always going to be our line. And you may have different goals in one direction or another direction, but our job is to do this. And we want you as our stakeholders to help us stay true to our line, but our line is not your line. Number 9, going to where your audience is. Just like any good social norms campaign or any campaign ever, you need to be able to reach the platforms where you will find your audience. The balancing education with the industry partnerships. The industries have been really, really incredible at helping us disseminate education messages to consumers, as long as we've engaged them along the way as those partners. Like, our role really is safe, legal, responsible. We're only going to promote safe, legal, responsible. We're not talking about medicinal use. We're not talking about benefits. We're talking about safe, legal, responsible for adult use. That has been a really important industry partnership. And then lastly, that definitions really do matter. Like I said, cannabis, I do like to use the word cannabis because marijuana does come with that racist history. And yet we also know cannabis is inclusive of products that we're not talking about. And so when we were talking about legal use, it gets really muddy. And so definitions really do matter, and being careful what those definitions are so that you can have a clear message. I wish we were able to update our language across the state, but it is very challenging given all of that. So with all of that, I see that there are a lot of questions. We'll get to that in all of the questions in just a few minutes here. But I just want to say thank you for letting me share a little bit about the lessons learned along the way. We continue to learn a lot as we go and are always happy to share more information. There is a national nonprofit, or actually, I don't know if they're a nonprofit. There's a national group membership association called CANRA, and it is a membership organization of all of the regulatory side of legalized cannabis in every state, but they have subgroups that talk about things like what education efforts are happening in every state. And so I highly recommend joining that group, CANRA, if your state has legalized. The official member for the group will be your regulatory entity, but they can include other prevention, education, food safety. They have groups for everything that meet monthly or bi-monthly. So it's really great group to get involved with so that you can ask questions and get feedback from all of the states at once, instead of really having to go state by state by state to ask a lot of questions. So I highly recommend getting involved with CANRA in order to keep learning more. So with that, I'm going to turn it back over to Taylor.
Allie, thank you so much. That was great.